Hi dear doctors, welcome to the class of Kids Covery. Myself Dr. Parv and we are discussing pediatric orthopedics, and the topic of discussion in this class is a very important topic which has been asked a lot of time, that is called as Osteogenesis Imperfecta. Now as the name suggests that there is a problem in the genesis of the bone and of course the other parts associated with the bone, but mainly the bone itself. So osteogenesis imperfecta means imperfect genesis of the bone. Okay, so basically bone is made by what? It is made by the collagen fibers, and I have taught this thing, of course, that bone is itself having in the spelling ONE1. So which type of collagen is involved? So collagen type 1 is something which is involved in the bone formation. Why? Because collagen type 1 is the strongest collagen out of all the different types. So basically it's a congenital disorder caused by decreased production of type 1 collagen. Okay, because type 1 collagen is not getting formed, that's why there is a abnormal bone which is being developed. So why does it happen? So osteogenesis imperfecta. So please remember that osteogenesis. Okay, osteogenesis. So who do you think is the generator? Who is the generation? The God. The God is supreme. The God is supreme. The God is dominant. So please remember, osteogenesis is a dominant disease. It's a autosomal dominant disease. Okay, autosomal dominant disease which is going to have a mutation in COL gene. Okay, COL1A1 and COL1A2. COL1A1 and COL1A2. So God is actually what? A1 quality, na? God is A1 quality, so COL1A1 and COL1A2. So basically what happens is that type 1 collagen is not going to form, so there will be defect in bone, there will be defect in tendon, there will be defect in sclera, and of course the dentin also. Dentin is something structure in the teeth. So the child is going to present that there is a poor dental hygiene, poor teeth quality, then sclera. So now because there is insufficient amount of collagen, the sclera is not formed properly. That's why the sclera will be blue because of the underlying vasculature. I'm repeating, because the sclera is not formed properly, because there is no or deficient amount of collagen which is available. That's why the underlying blue color of vasculature will be visible. That's why the sclera is going to be blue in color. So if the examiner gives you multiple fractures, okay, I'll try and see. Yeah, so if the examiner gives you a history of brittle bones, okay, bones are brittle, the bones are curved. Why? Because they are not strengthened enough. They are not strengthened. So have you visited the park, where one of the stick will be very hard and the other bamboo sticks or something will be like curved ones? Why? Because they are not very strengthful. That's why in the osteogenesis imperfecta you will be having the curved bones, because they don't have the strength. And can you see this blue discoloration which is seen in the eyes? Why it is so? Because the eyes don't have enough amount of sclera, and because of the absence of sclera, the underlying vasculature will be very much prominent in what you call it as a blue eye. Okay, and I don't know if you have heard this song or not, Blue Eye is Hypnotize. If you have not, just go check your Spotify and hear this beautiful version of famous Indian singer. Okay, so clinical severity. So what is the clinical severity? In mild cases you will have multiple fractures, and in severe cases you will be having fractures since the birth. Okay, even the born child is going to have multiple fractures. Okay, and yes, multiple recurrent fractures are going to be there because of the bowing of the bone. The child is going to be small, short stature, and joints will also not have the strength. So joints will have hypermobility. Okay, joints will have what? Hypermobility. And what is the non-orthopedic manifestations? Of course, blue sclera is going to be there, and it is to kindly cut that part. So why do you think there will be hearing loss? It is so because in the ear also you have got malleus, you have got incus, you have got stapes, and if the malleus, incus and stapes, three of them are not formed properly, then the bone conduction will be hampered, and since the bone conduction is hampered, there will be hearing loss. There will be tooth deformities also, because the dentins are not properly formed, which is called as Dentinogenesis imperfecta. And of course there will be increased risk of malignant hyperthermia also. Why? Because there is no protection layer of connective tissue which is available. So What will be the radiological findings? Of course, there will be osteopenia, there will be saber shins. Now what is saber shin? The shin of the tibia is going to be saber like. Saber like means it is rounded, it is curved. So saber shins, it is seen in the osteogenesis imperfecta. So what to do? First of all, please don't allow the baby to walk a lot, because you have to do the activity restriction, otherwise the baby will develop fractures. Also, to form, for the tooth deformities, please leave tooth. Even for the normal bones, we give the bracing. So what bracing does? Bracing just keep the limb in a particular posture so that there is no deformity which is happening. Have you seen generally our gardeners, they just wind up the bored plants with some stick or something? Why? Just to avoid the improper posture. Okay, we give the bisphosphonates. Bisphosphonates are actually the strengthening things for the bone. So bisphosphonates are going to increase the strength of the bone. That's why the fracture will be less, and of course the pain is also going to be low. We give the growth hormone also, because that's also somewhere associated with the increase in the length of the bones. Okay, and of course if there is any deformity, we have to do the surgical corrections. So what is the conservative management? Please do bracing, activity restriction. What is the medical management? Give bisphosphonates and growth hormones. And what is the end thing which we have to do? Like if the deformity has happened, you have to correct it surgically only. So just remember, brittle bones, blue sclera, bad hearing, bad teeth. Brittle bone, blue sclera, bad hearing, bad teeth is the classical tetrad of osteogenesis imperfecta. B, 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 B. Bad hearing, bad teeth, brittle bones and blue sclera. Okay, so just one take home message: blue eyes hypnotize. If somebody sings this song, I just want you to remember about the disease that is called as osteogenesis imperfecta. So I just want you to be very perfect in your work and don't be like, oh, I. Thank you so much and God bless you.